My name is Cassie Freese, and this is Emileigh. She's 3.5, and she has a brain malformation called polymicrogyria. It means too many small folds on the brain. So she's like a typical child with cerebral palsy, and a lot of the children develop epilepsy. We're fortunate that Emileigh does not have seizures currently, so that's a little bit about her. Me and her dad, we met in high school, and we always knew we wanted to have kids. And then when we had Emileigh, we were glad to find out that we were chosen to have a special needs child, because honestly, we had decided we wanted to eventually adopt a special needs child. We were thinking more of a child with Down syndrome or a child that is delayed, but we had never imagined having a child with medical complications along with that. So that's a bit of a challenge, but we're up for it. Some of the tests that we've had MRIs, we've had CTs, we get x-rays to check for aspiration, and we've had CTs for aspiration. And the MRI is actually what diagnosed her with her brain malformation. Emileigh has some of the things that help with her, since she's nonverbal, so sometimes it's hard to understand how she feels during a procedure, or how she might react to anything, whether it's noises or being touched. She tends to sometimes startle, and then she gets upset. So we've learned to ask for a child life specialist, or to see if there's anything we can bring in just to soothe her. And so she actually recently just had a CT last week, and when we came in, we told them we were concerned about her just being upset or startling, because sometimes with the equipment, the noises that it makes, it startles her, and it makes it a harder experience. So then if you ask for something, we actually got her to watch Frozen while they sedated her, so then it calmed her down, and then they were able to touch her and everything, and she did very well with it. One thing that I know special needs parents really appreciate is when clinical staff recognize that they are the patient and they are the child, and that they are a person. So I love it when they lean over and they talk to her, and they try and touch her shoulder just to calm her down, and just those little things that a lot of people don't realize that that's special. I mean, she's getting excited about thinking about it. So yeah, you like it. So we really like it when they treat her like a normal person, and that she's an individual as well, and she has wants, she has needs. We just try and help express those for her. For special needs parents, whether your child has sensory issues, or they're wheelchair bound and they're hard to move from their chair to the table, as soon as you come in, you can always be upfront with the people that check you in and just tell them any concerns you have, so then they can tell the people that come in, that are going to come out and get you, like the techs or the radiologist, so that they know that this is a concern. I feel like the staff is, they're very gentle when I tell them about some of her complications, and they thoroughly explain things, and I like to ask a lot of questions, so they always are willing to answer any questions I have. And then I always just feel like they go above and beyond, and ever since we've been here at Children's with her, that was part of the reason why I wanted to become an employee. I love the environment. I love everybody, they go the extra mile. They really do. And nothing is too large to ask them to help you with anything. So they've always made everything very pleasant, even when it's not a pleasant procedure or an outcome that you really want, but they're there for you even after that.